Hello and thanks for watching today's video. We're going to dive deep into the WISeR model, CMS's new Medicare pilot that's changing how certain devices reach patients and how your company gets reimbursed. By the end of this, you'll understand what WISeR is and how it changes the game, which devices and services are targeted, how the prior authorization workflow operates within the WISeR model, and who's affected and how it impacts your business. WISeR stands for Wasteful and Inappropriate Service Reduction. It's a 6-year pilot by CMS's Innovation Center, running from January 1st, 2026 to December 31st, 2031. It kicks off in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington, within 4 MAC regions. This program introduces technology-enabled prior authorization and prepayment review into traditional Medicare, something that hasn't existed at this scale before. WISeR applies to a select list of 17 outpatient services, historically prone to overuse or considered low value, including nerve stimulators like sacral, vagus, hypoglossal, deep brain and spinal cord, incontinence devices, spinal and pain procedures like epidural steroid injections, vertebral augmentation, and cervical fusion, knee arthroscopy for osteoarthritis, and skin and tissue substitutes and impotence treatments, among others. If your device fits in one of these categories and you're operating in those states, that is your starting point. Here's the new path prior authorizations follow for traditional Medicare patients. First, there's initiation. A provider submits a prior authorization request before delivering a WISeR targeted service. Next, there is routing. That request is either sent to the MAC, which routes it, or it's sent directly to a WISeR tech vendor contracted by CMS. Then there's the tech triage. The vendor uses artificial intelligence or machine learning tools to assess whether documentation meets clinical and coverage criteria. And then there's the final decision. A licensed clinician employed by the vendor makes the final authorization or denial determination. You may ask, what if there's no prior authorization filed? Well, then the claim is flagged for prepayment medical review, which triggers delays and increases denial risk. You might also wonder, are there exemptions? Providers with a high approval rate, like 90%, may earn a gold card exemption from future prior authorizations. This process replaces the more informal approach of traditional Medicare, creating an entirely new operational flow for providers. When it comes to how this affects your business, let's take a look at sales friction and delays. Even clinically appropriate procedures may face administrative delays or denials, making providers less likely to use or commit to purchasing your device. Then there's revenue uncertainty. If claims get denied or delayed, providers hesitate, uptake stalls, and cash flow becomes unpredictable. You also have to consider strategic differentiation. Device companies that proactively support their prior authorization process, providing documentation, training, and appeal tools, can stand out and maintain adoption momentum. Finally, there's future expansion risk. CMS may expand WISeR beyond these 6 states into new services if the pilot reduces cost without harming care. That broadens your exposure and urgency to adapt. So here's a quick recap. We have the element, which is how WISeR changes it. The scope is traditional Medicare and 6 MAC regions. It covers 17 outpatient procedures linked to medical devices. The authorization flow is provider, MAC or vendor, AI triage, then clinical decision. The fallback is if there's no prior authorization, the claim is flagged for prepayment review. And then there's the provider incentive, that gold card exemption available for high compliance and approval rate. So now you may be wondering, how do we incorporate the WISeR model into our business strategy? It's important to know that WISeR isn't a small policy tweak. It's really a fundamental change to Medicare's cover workflow. For device companies, it raises the bar. You may need to sell not just your technology, but the workflow support around it. Start building prior authorization tools, documentation aids, and provider training now, and you'll stay ahead. Not just survive, but thrive in this new landscape. Thanks for watching. Feel free to reach out if you have any questions. Our team can help you navigate any challenges you face.